So as many as 25 million men could face prostate surgery this year, but a new non-surgical procedure could be a complete game changer. Dr. Fischman is an interventional radiologist. He's also a professor of interventional radiology, urology, and surgery at Mount Sinai in New York. And he joins us this morning. Thank you, first of all, for coming in.
Thanks for having me.
So tell us about this procedure. What's it called? It's
actually called Prostate Artery Embolization, or PAE. It's done for men with enlarged prostates, and as you know, it's incredibly common. 50% of men over the age of 50 have this problem, and it often leads to really significant problems that affect men's quality of life. Getting up in the middle of the night to pee, a lot of urgency, weak stream. Some men even get blood in their urine or infections.
Yeah, and it affects so many men.
Yes.
So many men. So what makes this procedure different from others?
Well, the traditional way urologists would treat this is something called transurethral, where you go through the penis and you remove tissue from the prostate because it's causing a blockage.
That sounds painful.
It's actually very uncomfortable, and that's why a lot of men don't want to have treatment. But this is completely different. We actually put a catheter, a small microcatheter in the artery in the wrist, and we can navigate that all the way down to the prostate artery through the bloodstream. When we find the artery, we can block it. And we block it with different materials. There's beads, and there's a new type of material called a medical grade glue. And once we block the artery, the prostate starts to shrink over time. And so many weeks later, the patients start to feel so much better.
Interesting. So is it like almost, I guess a camera is on that?
Well, we use X-ray to guide it. So it's a small, very small microscopic type catheter. We guide it through the body with an X-ray.
Very interesting. How long does it typically take, the procedure itself?
It depends, but typically about an hour. We don't have to use any general anesthesia. You can go home right after and you recover at home. After a few weeks, most patients start to feel a lot better.
I was going to say, how long does it take to actually, for them to feel the difference in?
Well, I see all my patients 6 weeks after, and by that time, most men have a dramatic improvement. The best part of my job is seeing them and having them tell me how great they're feeling and how it's changed their life dramatically.
So is it done as an outpatient procedure?
Yeah, it's an outpatient procedure. Doesn't require general anesthesia. It can be done in the hospital, but many of them are done outpatient. That's right.
Wow. So is it done at hospitals around here, or is it just in Mount Sinai and you're trying to get more people to do it?
It's done all over the country.
It is?
I actually started doing it about 15 years ago. And I trained with one of the pioneers in Brazil that developed this procedure. And we bring it to lots of patients in the New York area, and there's people all over the country that can do it as well.
So are there any side effects from it at all?
Well, there's side effects with every procedure, but the great thing about this as compared to other procedures, specifically in transurethral procedures, is it doesn't affect men's sexual function, which is a huge problem with some of the other procedures that are being done for this.
This is a game changer, isn't it?
I think so. It's a great, I just feel really, really fortunate to be part of it.
I mean, when you think about it, for so many men, that 25 million men affected by, enlarged prostate, if they knew about this procedure and could change one, and choose between the two.
Yeah, well, when the decision is to do something minimally invasive or something more invasive, most men, after having a discussion, realize that they want to try something that's less invasive.
Is it covered by insurance, or is that kind of a sticking point?
No, great question. It's covered by most commercial carriers as well as Medicare. And my patients can come in, they don't have to worry about that. We have a staff that takes care of all the insurance issues.
So if someone is watching this morning, they say, I would like to get more information, I want to talk to my doctor about this, what's your advice to them?
Well, the most important thing is to speak to their primary doctor if they have BPH or enlargement of the prostate. And if they do, they should reach out to see somebody for this procedure. You can get more information about me at my website, drfischman.com, or you could even call the office directly at Mount Sinai.
Awesome. Thank you so much.
Thank you.
Appreciate you being with us.